ourselves in the country over the outbreak of Lassa Fever in some states of the country. I am delighted to welcome you all to this vitally important briefing, which is intended to sensitize the media and the general public on the current disturbing Lassa Fever outbreak in Nigeria. The experiencing Lassa Fever outbreak in several parts of the country with reported cases of fatalities. Latest report from Nigeria Center for Disease Control, NCDC, released on 25 January 2020, has it that 195 confirmed cases and 29 deaths have been recorded in 11 states of the Federation, namely Edo, Ondo, Ebonyi, Delta, Taraba, Plateau, Bauchi, Ogun, Abia, Kano, and Enugu. Out of the confirmed cases, 89% are from Ondo, Edo, and Ebonyi states. It is against this background that the Federal Ministry of Environment is organizing this press briefing to respond to the increasing number of Lassa Fever cases across the country, sensitize the general public on Lassa Fever preventive and control measures to avert further outbreak and spread, as well as efforts being made by the ministry in collaboration with NCDC and other stakeholders in tackling the Lassa Fever scourge. Gentlemen of the press, Lassa Fever is endemic in Nigeria and often associated with poor sanitary hygiene practices, with cases being recorded all year round. The Lassa Fever virus is transmitted by rodents, specifically rats, which can be found in our environment including homes, motor parks, offices, and other places of worship. This contributes largely to the risk of spreading that spread that occurs in Nigeria and other countries with similar ecological factors. Lassa fever is an acute viral hemorrhagic illness. It is transmitted to humans through contact with feces, with food or household items contaminated with rodent, which is rat, urine or feces. It can also be transmitted from person to person through contact with either blood, urine, feces, and other bodily fluids of an infected person. Early symptoms are fever, headache, diarrhea, abdominal pain, sore throat, cough, etc. It is in very severe cases that the patient bleeds from body openings. The maturity period of Lassa fever ranges between 6 and 21 days. Before the recent outbreak, the ministry has taken preventive, proactive measures to improve the overall general sanitation and hygiene situation in the country. The ministry in 2019 established sanitation desks in all 36 states of the Federation, and these sanitation officers are to coordinate sanitation and related activities within their states, liaise with their respective local government environment department, and report back to the Ministry of Environment. They are also expected to monitor and report Lassa fever cases and other environmental determinants of diseases to the Federal Ministry of Environment, headquarters in Abuja. The sanitation desks are to be replicated in all the 774 local governments in the country. In 2019, the Federal Ministry of Environment, with the support of World Health Organization and in collaboration with Nigeria Center for Disease Control, NCDC, carried out environmental sanitation response activities to Lassa fever outbreak in Edo and Ondo states. Activities undertaken include rodent control, deratization, sensitization, education of community members on Lassa fever, prevention, control measures, premises inspection, distribution of fumigation equipment and chemicals, waste bins, and rodent traps. Recently, officers of the ministry and the NCDC were on a phone-in program at Radio Nigeria on Saturday, the 25th of January 2020, to sensitize the public on the Lassa fever outbreak, as well as create awareness on preventive and control measures. However, this sensitization will be a continuous exercise and will be taken down to the grassroots, such as local government communities, mosques, churches, markets, schools, motor parks, restaurants, hotels, and to any place where there is a likelihood of large gathering of people. Gentlemen of the press, ladies and gentlemen, let me use this opportunity to inform you that the Federal Ministry of Environment has directed all environmental health professionals in the Federation, in the federal level, state and local government, to immediately re-embark on the following. 1. Massive awareness campaign on the need to keep the environment clean. Health surveillance of premises to identify rodents harborage, destroy, eradicate rodent homes, commercial and industrial premises. Effective pest and vector control services in residential and commercial premises of marketplaces and homes. Development of sanitary means and facilities for drying of food, cereals, legumes, and tuber to ward off the invasion of rodents. This strategy shall be deployed, and the Environmental Health Council of Nigeria is there to monitor compliance and report back to the ministry. The ministry is putting in place environmental health and sanitation surveillance system. This surveillance system will strengthen the cooperation between state and federal government on environmental health and sanitation issues. It will also help in information data gathering and sharing between federal, state, and local governments. The ministry, through Environmental Health Registration Council of Nigeria, EHORECON, is also organizing capacity development program on entomology and public health pest control to study more especially those rodents of public health importance in order to control them. Meanwhile, citizens are advised to imbibe good sanitation and hygiene practices and take preventive and control measures that include 1. Keeping the environment clean to avoid contact with rodents. 2. Keeping food away from rodents. 3. Storing grains and other foodstuff in rodent-proof containers. 4. Disposing waste regularly and far away from the home. 5. Cooking all foods thoroughly. Blocking right heart out, deratization, and to avoid and stop eating rats as much as possible. Washing hands regularly with soap and running water. Using protective equipment, example, masks, gloves, gowns, etc. in healthcare center and when caring for the sick. Ladies and gentlemen of the press, I want to use this opportunity to ensure that the general public that the Ministry of Environment remains committed to ensuring a clean and healthy environment for all Nigerians. I therefore call on all members of the public to keep their surroundings clean and be vigilant. Progress to join the Federal Ministry of Environment, NCDC, and other stakeholders in fighting the scourge of Lassa Fever by informing, sensitizing, and educating the public on preventive and control measures. This outbreak, since this is something that is endemic, meaning from time to time it's always there. Only that when it gets out of hand, that it becomes a serious epidemic, but it's endemic. So we are already working on it, the mechanism is there. We are reaching out to each of the local government, and very soon, one by one, or in batches, we'll get to this 774 local government councils across the country. Thank you.
Thank you very much, Honorable
Minister of Environment, directors, and heads of parastatals, dear President, invited guests, gentlemen of the press, ladies and gentlemen. It's my privilege to have been asked to make some remarks on the ministerial briefing that is holding today. On behalf of the Minister of Environment, I want to say a big thank you to the Honorable Minister for taking this proactive action, scheduling this very important press briefing that is really timely and very important for the benefit of creating further awareness to safeguard lives of citizens in the country. I must mention our deep sense of appreciation to the members of the press that have come in these numbers, who actually have taken time to be here to grace this important press briefing designed to create awareness, enlighten the people on the current challenge of Lassa Fever. Kindly permit me also to express appreciation to our international and local partners such as the World Health Organization, the National Center for Disease Control, Federal Ministry of Health, Ministries of Agriculture, Works and Housing, and the National Orientation Agency, who have demonstrated their support to ensuring quick environmental response to the epidemic. Let me, in conclusion, express my profound gratitude also to all and everyone present